Good afternoon, ladies and gentlemen, members of the COVID-19 Media Corps. On behalf of the National Health Emergency Committee and the Risk Communication, Social Mobilization and Community Engagement Committee, I would like to welcome you to the 45th National Situation Report presentation by Dr. Mustafa Bite, Director of Health Services. Dr. Bite.
Good afternoon once again, ladies and gentlemen. So we are here again to bring the daily updates. This is the 45th National Situation Report since confirmation of the first case of novel coronavirus in the Gambia on the 17th of March 2020, when we recorded the first COVID-19 case. A new laboratory confirmed case has been recorded, making the cumulative total number of cases confirmed in the country to be 18. Another probable case has also been recorded. Both the newly confirmed and the probable test results are results of samples collected from the mass screening held in Bakau. While the confirmed case manifests symptoms similar to those of COVID-19, the probable case is asymptomatic. Whereas the probable case is linked to the 12th case, the epidemiological link of the newly confirmed case to any of the previous confirmed cases is yet to be established. Out of a total of 194 test results received, 192 tested negative, 1 was inconclusive, and 1 tested positive for COVID-19. Training on case management, sample collection, risk communication, and infection prevention and control was conducted by the Central Level Rapid Response Team in North Bank East Region. Whereas 5 persons were newly taken into quarantine, that is 2 from CRR and 3 close contacts of the 12th case, 1 individual was discharged after testing negative for COVID-19 upon completion of the mandatory quarantine period. The country currently has 101 persons under quarantine, 8 active cases, and 3 probable cases. A total of 1,029 tests were conducted, 18 are positive, 323 people completed quarantine, 735 contacts traced, and 310 people completed follow-ups. Globally, since 31st December 2019 and as of 6th May 2020, a total of 3,818,577 cases of COVID-19 have been reported. Of these, 264,807 deaths were registered, and 1,292,296 recovered from the disease. Senegal recorded 1,433 confirmed cases, 493 recoveries, and 12 deaths. On logistics and safety, security personnel are enforcing the social distancing practice in various areas in Kanifing municipality, ferry crossing points, and markets. The Tourism Security Unit, or TSU officers, embark on routine beach patrol to enforce the social distancing measures. Anti-crime unit, in collaboration with Gambia Immigration Department, conducted an operation in Lower Nyomi on social distancing, where 17 Senegalese were taken into custody for illegally entering the country. 16 of these individuals were handed over to the Amdala Immigration and 1 to the Amdala Health Post for further medical assessment and management. 26 people, that is 23 Quranic students, a bus driver, and his 2 apprentices, were intercepted whilst returning from Senegal. All these were taken to a health facility for screening. 3 manifested high temperatures and have been isolated for possible sample collection. On surveillance, 9 laboratory technicians and assistants from Farafenye, Nguyen, Kerewan, Salikenye, and Ilyasa were trained on COVID-19 sample collection. 12 health workers in North Bank West region were oriented on risk communication and contact tracing. 11 samples were collected, 9 from the contacts of the 11 case and 2 from an orderly working at Farafenye, RCH, and the Sun. Part of the response team briefly visited the surveillance officers at Kir Ali point of entry to extol them for the good work they are doing. On case management, Farafenye RCH and nearby health centers train on case management and IPC. Psychosocial support services rendered to 36 persons under quarantine. Psychosocial education provided to the family being stigmatized in the URR. On risk communication and community engagement, 4 TV and 8 radio programs successfully conducted, 1 press briefing conducted, 11 communities and 760 households sensitized or engaged on COVID-19 preventive measures using existing community structures. Summary of social activities: 2 Facebook and 2 Twitter posts shared with a cumulative engagement of 13,228 people reached. Summary of calls made to 1025. A total of 211 calls received. 201 were COVID-19 related and 10 were non-COVID-19 related. 4 were booked for further follow-up by rapid response teams and 5 booked for further follow-up by the quarantine team. Regarding the next steps of the ministry, to ensure there is a synchronized cross-border surveillance system with Senegal, RRTs to investigate and establish the possible source of infection of the new case vigorously and systematically. Follow up with the Supreme Islamic Council on the domestication process of safe Ramadan guidelines on COVID-19 preventive measures. Strengthen surveillance at all points of entry, including the undesignated ones. Voluntary testing of all patients with respiratory symptoms at all health facilities. Engage private pharmacies to report clients presenting flu-like symptoms to the rapid response teams. Finalize SOPs on community engagement and social mobilization for social and behavioral change approaches on COVID-19. Strengthen RRT and contact tracing teams at all regions and deploy newly hired health personnel to their duty stations. Finally, COVID-19 is real, and we would like to urge the general public to strictly adhere to WHO and the Ministry of Health recommendations and guidelines on COVID-19 by desisting from public gatherings and practicing social or physical distancing. Specifically, we would like to reiterate our call to all stakeholders involved in the quality sales or wanted, shopkeepers, salons, barber shops, tailors, and general merchant dealers, that the state of public emergency regulations on their business operations remain valid and will be enforced by the local government authorities and security personnel. We encourage the public to comply with the security forces and COVID-19 personnel whenever they appear to carry out their duties in containing COVID-19. We would like to thank the general public for increasingly using the toll-free line 1025 to report suspects, and they can continue providing valuable information to the call center. Together we can defeat COVID-19 in the Gambia. Thank you very much for your kind attention. So thank you for the question. I think it will depend on the case definition. So the case definition is being expanded. And so, for example, previously it was only if you have flu-like symptoms or you are symptomatic and then you have a contact, or you are symptomatic or you are coming from a country where this is there, so you have a travel history. So then you'll be called a suspected case. But now it has been expanded and it is going to include all the ones with flu-like symptoms. So that means you'll be a suspected case. And in this case, we'll use all our tools, the risk communication, psychosocial, to counsel you so that you'll be isolated and tested. But if all these things fail, then they will have to use maybe more rigorous tools to ensure that you are tested. Because now it's not only about you. When you are a suspected case, and we understand that you have to go through that grief once you have this bad news. And our people are trained to handle that, to take care, to make sure that they do all their best not to resort to force. But if it comes to the crunch, then the last resort has to be used. But you have to understand that this will be after all other methods are exhausted, after using religious, using political, using risk communication, using everything possible to ensure that we do it amicably. Thank you.
Thank you very much, Nelson. You asked about whether we have plans to do similar mass screening in communities, especially, you make an example of Farafenni. Basically, our plan at the beginning was to do mass screening in communities that we have registered cases. We've tried to go to 2 communities. It has been difficult, it has been a challenge. And then we went to Bakau, and we have been warmly welcomed by the community of Bakau. And we did the screening. And now that the rapid response team, they are currently in the North Bank, in Upper River Region, and Central River Region. And when I talk about the rapid response team, it's a combination of all the subcommittee members. You have the logistics, you have the case management, you have the risk communication, you have the psychosocial support, and as well as laboratory and surveillance. These are the team that are currently up-country, trying to see and talk to the regional authorities, the regional health teams, and as well as the communities that most of these cases came from. And then now that after that discussion, now they will also now start to find out from them whether they will be able to accept for us to do mass screening. These are all these things that we have to discuss with them. We have to negotiate, and we also have to sound our opinion. We don't want to force any community to say you have to come or we have to do mass screening in our community. At that stage, we haven't reached to that stage yet. We don't want to force anyone. We want to do our intervention, and people will look at our intervention, and then based on the benefit they have attached to that intervention, then we want other communities to come and say we are interested in it. We want you to come and do mass screening in our communities. Right now, because of the Bakau experience, many communities are now on the verge of requesting for us to go and do mass screening. So we have to take our time in this process. So we have to be guided by the guidelines, and we also have to be guided from the laboratory and also the technical committee, trying to see the feasibility of mass screening and also what next after the mass screening. We know that when you do mass screening, you need to also you are expected to have maybe more cases, and do we have the capacity, for example? So all those things, we need to put those into consideration. So that is what we are discussing right now. And I'm sure right now when you come to our treatment center in the sanatorium, it's well equipped, and also the required beds are there. And then we also looking at now trying to finalize that one, the Deman clinic, the former Deman clinic. That is all, the renovation is also ongoing. And also there are plans also to have treatment centers in all regions, so that when all those things are in place, logistics are in place, then definitely we can now say comfortably we want to go into mass screening. And then now, so that when we have more cases, then we have no trouble, we have no difficulty in getting these people to be taken to the treatment center. But that is as of now. When when the team comes from the track, they will give us a report, and based on the report, or not, there are some challenges whilst they're in the field. Today, this morning, we were discussing some of the challenges, and then when they come back, they'll give us a full report. But at least by today, we should be able to have the report, and tomorrow we'll review it and we'll discuss it in the meeting, and then that report will now determine as to what next do we need to do in that particular community. So be rest assured of that. At any stage we are doing this type of intervention, especially mass screening, or planning to do mass screening, or to do other intervention, we'll keep you informed as we are doing currently. Thank you. That's the first part I want to respond to.
So thank you. I think he's already answered this. So the testing, he talked about already the capacity. So it depends on the capacity. So, for example, right now, the labs we can do, there's a limit as to the number you can do per day. And our lab also at the National Public Health Laboratory is also getting ready. So as we increase the capacity, and we also want to test up country. So right now, to make it people to be able to get their results exactly within 24 hours will be difficult, because it's the capacity we are looking at, and the process of the lab, how you go about it. So because we are using a very accurate form of testing, which is the PCR, and it's very labor intensive. It requires a whole team, and it requires a lot of steps, to do. So normally when they started, we have a specific time they start. Before, they were starting at 12 midday, so the results usually come out around 9 p.m. or 8 p.m. But now they are starting earlier, I think 8 or 9. And then if there are no problems, because also if the batch is big, if the batch of samples you are doing is big, then sometimes you might have some issues with the results and you have to check again and all. So basically, usually we have the results around 6 or now around 8 maximum. So it will be very difficult now to go back to the patient at that time to tell them, this is your results, because you need to, if it is positive, for example, requires some counseling, requires other things. So that, and you need to sort it out. The way the results go, they don't put names there, so they put numbers. So after the results come back, you need to, so that things don't, people, when you are dealing with these things, it's better to just anonymize it and use numbers as much as possible. So it's a whole system, and to make it available within 24 hours will be very difficult for us, like quickly, like that. So it's good. You need to make sure that the results you get is quality, and also that you don't make mistakes, because you don't take somebody's results for someone else. So that's why you have to be very careful, check it all out, and then before everything is released. So, but as we get more sites, that will be possible, inshallah. Thank you. More test results here. So then ko combine. So buñ doon def test yi Bakau bi, am na yeneen test yu ñu doon also def si community bi. Like some tests were taken from some facilities, am na yeneen kër yu ñëwoon some symptoms. Yes, so the badge, so test yi dañ ko dee, because test yi ni dafa important nga denca ko in a very good way. Ida nga extract ko njëkka, because su dul loolu dafa deteriorate, comme lu mu doon wax njëkka. Moo tax ñu ngi xelaat how to do mass testing ak yooyu. Because test bi soo ko bàyyee in a place for a while, te maybe treated loo ko noo ko war a treaté dina deteriorate. And so moo tax first test yi nii dañ baajoon test yi. So ñu ngi go from the yu njëkkoon a def, including yu xew si community bi. So basically most of these are the first day Bakau bi, and some yu nekkoon si community bi. You understand? Yeah, so but right now there are other tests which are being tested. The results are not yet out, but they are being tested already. Maybe tonight we'll get more results of the subsequent days. So we are reporting up till 10 a.m. today. The last results we received today was around 10. So maybe by 6 then I'm adding results and all. So process like that. You them pull together and they are batch and we are testing them as we go. So Madagascar send drug we are hearing different things ñu ko study. Because nekku ne lu jógee Africa rek baaxut. So dañ war a bàyyi xel. So comme garab bu gaay di wax dafa jógee si comme antimalarial garab yu ñu dee use, artemisinin for the family. So ñu ko study, we are reading about it, and we are looking at all the information coming out. Just like hydroxychloroquine bi, bu mu génnee xam nga boobu antimalarial la with some viral properties. So boobu tamit bu mu génnee ñu ko doon xool, waaye léegi evidence bi mu ngi wane ne is not conclusive. am na beneen bu génn es tamit boobu tamit Europe la génn and boobu is very promising and America ñoom fa naa start nañ di ko use so bii tamit ñu ngi gis lot of studies neen review studies yëpp and then suñ gisee good evidence then we can even have recommendations or trials here or what, but not necessarily because it's from Africa doesn't mean it's not, we just write it off. We'll look at all the data that is there and then we decide whether it's going to be recommended or not. So like comme affaire Gambia lan leen nekk di fajee nit yi yàlla mu ngi ñu dimbale so far am nañ ñu serious waaye maybe before they were admitted in our treatment center unfortunately they were late moo nekk that one the one from Bangladesh boobu dafa gaañu woon balaa moo egga suñu center waaye so far yu nekk si center bi usually most of the time they've not required some serious ICU services for now because you remember that 80% of the cases duñ dee nekk severe about 20% ñooy nekk severe disease and out of that 20 maybe 5 will be critical so far nekkaguñ di am those very very serious cases but what they are doing at the treatment center is to give them symptomatic treatment, address their needs. So you may fever, they take care of it with pyretics. Some of them are put on some of the antibiotics and giving them just the treatment symptomatically or supportive treatment to maintain them. And most of the time then they are mild or moderate. They have not been very, very severe so far. So that's why in the Gambia, that is what is going on. Thank you.
Right. We will definitely try to strategize so that when we do the press briefings, we will now try to summarize the press briefings in both English language, and then now we do the same thing now into local languages, Wolof, in just 5 minutes or 10 minutes, just to make sure that everybody have the understanding as to what. So what we're going to do, we'll just look at our statement now. The team will look at it and try to shorten it. And so that after that, because we're also mindful of the time, so we'll also shorten it so that after that statement, then we'll do the Wolof and then the Mandinka within 10 minutes, and we'll do that, and then we can have question and answer session. So if it is okay with you, we can start that tomorrow, and then Saturday we'll be in the field with some of you, and then we will do our press briefing also on Saturday in the field, whilst we are in the field. So. That is the plan now, but from now on, we will do that. We'll try to summarize the statement, give the key facts, and then from there we will do the same summary in the local language. So we apologize for that, but I think we did the last time, and I think you are right, so we will do that. So because we are also mindful of the time factor, that's our challenge. But now, this is the strategy we want to do, summarize it, and then also make sure that other languages are also captured. So thank you very much.
That's it for the day. Thank you all, and see you tomorrow, as you say, with more local translations. Thank you for coming. Reach home safely or go to your studios safely.